program. And that's it for me. Thanks very much.
Great, thanks very much, Dr. Tucker. Great presentation, and thank you to all the presenters for your excellent presentations today. Thanks also, Dr. Tucker, for catching us up a little bit. So we've got about 20 minutes now for questions and discussion, and I see that there's been lots of comments and questions coming in, so we've been keeping track of those, and we'll pose them to the presenters. And I encourage you to continue to submit your questions, and we'll get to as many as we can in the remaining 20 minutes we have, and any that we don't get to, we'll make sure to follow up and provide responses. I just want to remind everyone that we'll be providing a copy of the slides as well as the recorded webinar following the presentation. It'll take a few days, but we'll send it out to all the registrants. And if you have any questions, please feel free to email admin@cdpac.ca, and we'll answer those. So we'll start off right into the question periods. So one of the first questions that came in is directed to PJ, and it was a question that says, I know the Nursery Daycare Act in Ontario is beginning to be revised. Are you involved in those discussions?
We aren't, but I think what Patricia might be, I'll let her answer that, but I think what they showed in their research is that everybody is looking at this right now, and it's really an important time to be having the discussion.
Dr. Tucker, do you have any additional comments on that?
Hi there. Sorry, I am not involved with the revisions to the Ontario Day Nurseries Act, but I do know that, as Dr. Naylor said, a number of the provinces are currently modifying their regulations.
Great, thank you. Next question was, are you planning to involve Ontario in the Healthy Beginnings project? So I think this was directed to Vanessa, but maybe Peach and Vanessa, you could answer this.
Vanessa?
Well, right now the Healthy Beginnings materials are available online for anybody to use. So Ontario wasn't, as you saw, when I presented, a specific a jurisdiction that partnered with us on this project. However, I've actually been in touch with a couple of different regions in Ontario that have asked to use the resources, and they are currently in the middle of doing like a pilot program themselves where they are using Healthy Beginnings resources. So nothing specific planned at this time, but I do know that it is being used across jurisdictions.
And I just want to highlight with those resources, one of the key things that happened through the class project is the first thing we did was say we don't want to reinvent the wheel. So you'll notice that the resources is bringing together existing practices and things. I see somebody talking about the great initiative in Manitoba, and this isn't meant to really be the penultimate resource. We made it so people can slide things in, slide things out, deal with what their jurisdiction has, use what they can. The HOP resources were shared by the Dakota there, so that the practices are there. We put in Canadian resources. So just one of the key things we did when we were going across jurisdictions, saying we don't have money to be doing a fancy independent resource, and a lot of people are doing fantastic things. Let's just use this as one opportunity to put things at somebody's fingertips.
Mm-hmm.
Thanks, Vanessa, and thanks, PJ. While we're on that line of discussion, there was another comment that came in, or question that came in, about what are the next steps regarding Healthy Beginnings in BC, and will this training be expanded to more areas?
Yeah, so with Healthy Beginnings in BC, I'm located in BC. I'm in Victoria, and we do have a bit of a sustainability budget where I will continue to run training sessions. So I've actually got a couple of sessions booked over the next few months where childcare practitioners will be signing up, and we run the sessions for about 15 to 25 practitioners at a time. And yeah, so the word is still out there. A lot of the sessions that we've run have been facilitated through the childcare resource and referral centers, as well as been contacted by other organizations. And we're also looking for future partnerships for sustainability and to increase the impact of the Healthy Beginnings training across the province even further.
Great. And PJ, did you want to have any additional comments on that?
No, I was just going to move on to the next outdoor one if you wanted to.
Yeah, that's what that
outdoor guidelines.
Exactly. That's the next one. There's a few questions and comments about the outdoor guidelines. Someone's surprised by the lack of emphasis on activity outdoors. And a comment from a licensed childcare licensing officer saying they're interested in the research and guidelines related to outdoor play and activity. And they find many childcare programs provide minimal outdoor time, and they often share barriers to providing daily outdoor time, weather, children's clothing, staff preferences, parents' desire for children not to go outside, etc. And someone commented that maybe climate has influenced outdoor recommendations. So any comments on that?
Well, there was no de-emphasis on it. If you see that, we said ideally outdoor playtime should be included, and you'll notice in some of the guidelines it is also mentioned. These aren't meant to be the only game in town. Like if we wanted to, if we're consulting at each province, maybe this area needs to be strengthened. Maybe the ideally wasn't strong enough, and it should be, at least half of that unstructured time should be spent outdoors. And one of the issues we found in the family childcare, the HOP research we did, was that this is problematic if people don't go outside because the rules for play inside totally restricted object control skills, so that if you aren't going outside, you typically have limited manipulative skills because nobody wants broken, in the family childcare, nobody wants broken things, indoor play like that. Now, the HOP resource shows a lot of let's make, soft balls, paper bats, rolling activities that can scarves, that can overcome these types of things. But I think you're right, outdoors is important. And for more than just physical activity, for mental health, for exposure to nature, it's one of the places where you can really integrate your literacy and numeracy and your other objectives. So not disagreeing, and just even the comment, I went back to look at ours and go, ideally, maybe not strong enough. So
I'll just elaborate a little bit. Like, this was a discussion as a working group for sure when we were coming up with the guidelines. And again, with working with multiple jurisdictions, it's hard to have a one-size-fits-all with some of this information. So I believe we used the term ideally so that we could make sure that we were encompassing the fact that we also had partners in Northwest Territories and Ontario, and that it would take into account for weather and location and all of that sort of information. So by saying ideally, but we also say across a variety of settings daily. So therefore, hopefully there's some time outdoors, but we're also talking about, the community recreation center, a community gym, different locations where children could be physically active. So we were trying to be all-encompassing without saying you have to do this when it might not be an option for certain practitioners or certain communities at a time.
Thanks, Vanessa and PJ. So more questions coming in directed around Healthy Beginnings. Any comments on the Healthy Beginnings eating resources in light of existing food flare resources?
PJ, I'll let you start with that one.
Oh, yeah. That's one in British Columbia. For those of you across Canada, we have a resource called Food Flare for Childcare, and it has been disseminated through 2010 and across the province for years. And this wasn't meant to replace Food Flare. Food Flare is a very extensive resource that deals with the feeding relationship, broader than just sugary drinks and fruit and vegetables. It's much more capacity building. So Healthy Beginnings was really to take into account those key messages we're talking on the healthy living front and put some guidelines and then put at the finger resources. So we even use some of the Food Flare information in this, but it isn't meant to replace it. It's really, this is another quick way that a child care provider can open the door to their resources in their province or Canadian resources. And then if they can't or don't have the energy to go looking, that there's some resources right there when they open up the document so that it doesn't become a barrier. So that was really our philosophy, not to replace what existed, but to direct people to what exists, and that changes via jurisdiction.
Yeah. And just to add on to that, again, with BC, quite often when I'd be facilitating the Healthy Beginnings training sessions, I'd be able to pull out the HOP resource manuals as well as the Food Flare for Childcare resource, because Healthy Beginnings was really built to be like a collaborative manual to both of those other resources. As PJ mentioned, we did partner and have permission with Dakota, who now owns the LEAP BC resources, to use these within our manuals. So the physical activity manual has many, many HOP games. And same with the Food Flare for Childcare. This was meant to really be a complementary resource to some of those that already existed and not something to replace them.
Good. And next question coming in again around Healthy Beginnings. Now this time regarding indoor activity, what are some examples of low to moderate physical activity? And could there be examples of low physical activity that occurs in a classroom rather than a gym?
Yeah, and so this again really gives a nod to the HOP resources. So PJ highlighted it just a little bit earlier, but the HOP resources are meant to be played inside as well. So there's a list of equipment and different crafts that you can make that provide the kids with the actual physical activity equipment that they need to play the games, if it needs any equipment at all. And it's all indoor friendly. So almost all of the games included in the HOP manual, or in the HOP manual plus our Healthy Beginnings manual, can be played indoors as well as outdoors. So they're using soft equipment, again, hopping, jumping, skipping. We were talking about that hand-eye coordination. So it'll be something like creating a paper ball, and there's a rhyme that has you throwing it like a snowball, and then children can be throwing the paper ball at a target on the wall, and it's not going to damage the facility. But again, it's doing that fundamental motor development within the childcare setting. So very adaptable for indoor in a classroom or outdoor or in a gym, or however you want to take it.
Great. And Vanessa, while you're speaking, another question on Healthy Beginnings. Well, first of all, comments saying that they're fantastic, and thank you. Are there any policy activities happening as a result or in conjunction with Healthy Beginnings?
Again, I will actually push that one over to PJ.
So I think this is what we're doing today, is we're so happy to see so many people on the line. When we were at the Global Conference on Physical Activity, there was a group of people everywhere in all the provinces interested in this guideline, whether it be policy via regulatory framework, better practice guidelines. We're starting to talk with some childcare licensing people who say when things can get taken into a standard, it's better. So this is basically the from this Healthy Beginnings work, we're hoping to start, and this call itself, to start a conversation across the country where we're all start to move this agenda. So in British Columbia, we're just underway with a physical activity strategy development policy, and dealing with better practice guidelines is one of the areas that has been talked about. I know that somebody on the line was talking about Manitoba, and that the guidelines are being revised. And I know I talked to somebody in Saskatchewan at the Global Conference. So there's a lot of movement, and that's what this webinar we're hoping to just start to give the documents that are in place. We'll circulate a U.S.-based better practice guideline document, and we'll circulate our review, and we'll circulate Patricia Tucker's review, and that shows you what's being done so far. The article from the U.S., was by McWilliams, and that's from Diane Ward's group that does work on the knapsack. They have a few different things around modeling, and so we're hoping this will leverage this discussion for people in every jurisdiction.
Thanks, PJ. And I think you've caught the last question there, too, around whether Healthy Beginnings is involved engaging the ministry. Did you want to add anything else around that? Or Vanessa, anything to add?
We involve the ministry in our consultation process during the first year of Healthy Beginnings, and we do actually have a slightly modified resource on the Healthy Beginnings website that uses BC-friendly language. We had a few people at the ministry review the manuals and provide feedback, so that we were, again, complimentary, and we're supporting the BC language and needs as well. But again, Jay, you can probably
it's on the agenda. We have been making presentations in British Columbia, and there's a really great opportunity as the physical activity, particularly on the physical activity side now. We have guidelines beyond that, but discussions are happening in all sorts of sectors right now as a result of the participation facilitated and BC Ministry of Health physical activity strategy development.
Great, thanks, PJ and Vanessa. So next question coming into Dr. Tucker. Question is, has there been any research about physical activity training for teachers and assessing teachers' physical activity knowledge? In BC, kindergarten is part of the formal school system, and kindergarten teachers are often trained teachers. So I'm wondering if teacher training has physical activity training as part of that.
Sure. I can speak to a small study that we conducted, and I'm sure there is other evidence out there, but I don't have it top of mind. But we did see that teacher education or teacher training was correlated with their competence to facilitate physical activity for kids in kindergarten as well. And in Ontario here, kindergarten is part of the school system, so they're trained differently than early childhood educators are. So we did see a similar relationship. It wasn't statistically significant, but we did see that those teachers who received increased training did feel more confident to engage the children in their care, or the children in their classroom, in physical activity. So a similar relationship was apparent.
And Patricia, we know that we just published results for, we know that they get about 30 to 50 hours of training in this regard. The generalist elementary anyways, and we showed that a trained teacher was 2.5 times more likely to provide the daily physical activity dose that's required in British Columbia. And for healthy eating, it was over 6 times as likely to have delivered a healthy eating lesson if they received training on promoting healthy eating in the classroom. So training and technical support is important, and there is actually I think across Canada, you would say that every elementary teacher has to at least have done their basic one-term course.
Yeah, okay.
Great, thank you. So I see we've got a couple minutes left, so maybe we'll try to work through the last few questions, and then maybe I'll ask all of the presenters if they want to leave the attendees with a few final comments. So let's try the last few questions. General question to all presenters: is anyone working on targeting healthcare providers for public health nurses or family first home visitors to get to early years kids that are not in care settings? In Manitoba, our numbers of kids under 6 in home and center care settings are low.
This is Trish. I'll start. I'm not actually working with public health professionals right now. It's certainly a great approach for reaching those individuals or those children who aren't captured via early learning centers, but it's not an area that I've explored as of yet.
And I don't think we've gone there as much, but we know we have to get to that family and who's reaching them. HOP went out to family resource providers, so places, and Strong Start is a major area where we do have an interface with the family, again, that's not necessarily a childcare environment, but I think this outreach piece is big, and I am not aware, which does not mean it's not happening, just I'm not aware of where it's happening and who's doing it.
And Bill, feel free to jump in, but our partners in the Yukon, we're also working on modifying the Healthy Beginnings resource to be a family-based resource as well. So I believe that's still underway with partners in the Yukon territory.
Yeah, that's right. Thanks, Vanessa. Actually, it's the Recreation and Parks Association of the Yukon in collaboration with the Yukon College Partners for Children. So they're actually developing a facilitator resource for families and communities to try to target that kind of non-care, sort of non-licensed or non-formal care settings. Great. So we're just at 2:30 Eastern and 11:30 Pacific. So we've come to an end. I know there's a few remaining questions left, but maybe if there's any key points that the presenters want to leave with the attendees today, or final resources that you'd like to share, I encourage you to do that now. So Brian, any final thoughts you'd like to share?
No, I just want to thank everyone who participated and attended, and hopefully, the information is useful to take back and implement on the ground, so to speak. So thanks very much to everyone.
Great. And PJ?
No, I just think if people are wanting to create a network, I saw somebody on there that we are interested in sharing across jurisdictions. And so I don't know, Bill, how you want to handle that, but I think that's a good one. And the second thing, somebody asked about disabilities, and there are subtle dealing with disabilities in the HOP resource, but that definitely needs to be a discussion about how that happens. So those are the two things I'll leave it with.
Thanks, PJ. And Vanessa?
Just thanks everybody for participating, and just some great discussion around our topics here today in the early childcare environment, and it's great to see everybody thinking in a collaborative manner. So thanks.
Thanks, Vanessa. And Dr. Tucker, finally.
I'll just finish as well by echoing my thanks for everyone's involvement, and I'll extend my apologies for speaking so quickly, but I wanted to make sure that there was time at the end for some questions as well. So thank you.
Great. Thank you, Dr. Tucker. And thank you to all of our presenters today for your great presentations. And thank you to our attendees for joining in and staying with us for an hour and a half. So a reminder, the webinar will be available, recording of the webinar will be available and sent out to registrants. And any final questions, I know there's a couple that we didn't get to, so we'll provide that as a follow-up, responses to that as a follow-up. And so I'd just like to thank everyone again for joining and wish everyone a good rest of their day. Bye, everyone.